Okay, welcome everyone to our third lecture on cystic fibrosis. Now, this is one of the first ones that you'll cover that is not a neurological disorder or disability. So you might remember from the first two that we've done so far, autism or ASD, as well as ADHD, that the type of problems that arise from those particular disabilities and disorders are neurological. They've got to do with the brain. Something's happening in the brain to make a person behave in a different way or to interpret the world in a different way. So I suppose you could say that it was less of a physical type disorder and more of a mind, psychological type problem. Now, cystic fibrosis, we'll probably go through some more medical type stuff here, but again, it's best to do the research and to talk to professionals, parents and nurses and things like that, people that you'll be working with on a more regular basis if you're working with children who do have cystic fibrosis. We only cover the basics here. It's certainly not an area where I would claim to be an expert. And again, we'll concentrate on the educational side of it as opposed to things like medication and diagnosis and so on and so forth. Okay, so now cystic fibrosis is characterized by a strong, persistent cough, which is not contagious, meaning they can't give that cough to someone else or someone sitting next to them. Cystic fibrosis is a fault or a mutation in a gene called the CFTR, the cystic fibrosis transmembrane regulator. Now, you don't have to remember that. Please don't even try to remember that. But just to remember that cystic fibrosis is a mutation in a gene. So it's a particular gene. They've obviously named it after cystic fibrosis. And it's not something that students get from poor diet like a lot of people would get from diabetes and things like that. It's something that they're born with, and it's something that isn't able to be treated very easily. It's not something that students can get over in a couple of weeks or spend a bit of time in hospital. There's no magic pill or therapy or anything like that that is suddenly going to cure someone of this particular disability. It has a life-threatening impact on a person. There is a life-threatening impact on a person with cystic fibrosis, such as not living as long as other people. It's a recessive genetic condition that is inherited from both a carrier mother and a father. Now, if you've ever done any biology, say in year 11 or at high school, or ever read anything, you'll know that there are recessive genes and dominant genes. I think dominant is the term. I apologize if I'm wrong there. So if you look at you'd have to do a bit of research on Google looking at how recessive and dominant genes work. But essentially, if you find the little table with the big B and the little b, and you'll know that you'll have to have a bigger capital B, for example, is the dominant and the little b is the recessive. And you'd obviously have to have the right combination of two little b's from a male and a female for that particular child to then have cystic fibrosis. If that makes no sense, then don't worry about it. We're not medical scientists or anything like that, or doctors, so we don't need to know that kind of thing in too much depth. But feel free to look it up if you are working with children who do have cystic fibrosis. Then that's definitely an interesting area, and in fact just an interesting area to look up in general, how for example redheads are, how those genes are passed on, and certain ethnic groups have different genes, some recessive, some dominant and so forth. But we're getting off the topic. What is cystic fibrosis? A recessive genetic condition. So the recessive, I mean, if one way to think of it is recessive means that the chances of it being passed on is a lot smaller. So if you basically have to have two parents who carry the gene, and the child has only a smaller chance of catching it, without getting into the maths or statistics, which I wouldn't even be able to tell you anyway. The recessive part means that if there's a dominant part in the gene, when it's passed on, the dominant part would say that they don't actually catch it, if that makes sense. And again, if you're interested in the recessive dominant gene and how that works, and you want a much better and probably correct explanation, then I'd recommend going to Google and there'd be or YouTube, and there'd be lots and lots of videos on that explains it in a lot clearer way than I'll ever be able to. Both the mother and father must be carriers. That's what we were just saying before. So they don't actually have to have cystic fibrosis, but they do have to actually carry it. So it has to be, and you can think of that as in they've got it inside them, but it's not active. It's not there's not enough of the gene for it actually to be active, is sort of, I guess, one way to explain it. But then if you combine that with another person when they have a kid, and those two less active genes, I suppose you could say, come together, then that's how it's passed on, through lack of a better explanation. It affects the lungs and digestive tract. Now, I suppose the first thing, probably the first thing I would say here is that cystic fibrosis the issue is with two chemicals that the body produces, and that's chloride and sodium. Two separate chemicals there. Now, they're the ones that cause all the problems, those two chemicals, because and again, without getting into the medical side of it, that you'll have to look up if you want to go down that road, those two chemicals help us do things like clear our lungs out, and process things in our pancreas, which helps us digest stuff and so on. So often kids, for example, might be able to ingest food so they can eat it, but then there's problems actually digesting it. Can cause problems with blood sugar level and things like that, similar to, I think it's type 1 diabetes. Obviously with lungs, it means that the child can have, if the mucus isn't cleared off their lungs very often, it means that they can get infections. And that's where that cough comes. So earlier we were talking about that cough. The CF gene gives instructions to the cells to make a protein that controls the movement of salt, and that would be the sodium that we were talking about there, in and out of cells. Okay, too much salt in cells builds up mucus, and this leads to health problems. So you might see, if you do a little bit of research on the internet, you might see people with cystic fibrosis, they can't clear the mucus off their lungs sometimes. So what will happen is they'll wear these vests, and the vests sort of shake a little bit, I guess you could say, and it helps them clear all the mucus off their lungs, and they might wear that for half an hour a day or whatever. And of course, talking about lungs, there's also specific types of infections. Obviously, they're prone to infections, and infections that I think they're called pseudomonas or something like that. Types of infections that other people who don't have cystic fibrosis wouldn't otherwise catch. So it's not necessarily something that people who don't have it would be able to catch, or it would worry them. But yet, two people with cystic fibrosis in the same room is often a bad thing, because they can give each other bugs backwards and forth and cause more infections and stuff like that. Okay, some facts. There's a 25% chance of inheriting cystic fibrosis from carrier parents. Now, that's assuming that both parents actually have the recessive gene, of course. And again, we won't go into that any further, as long as you know that it comes from the parent. But definitely go to Google and type in recessive dominant and look and cystic fibrosis and try and find out some basics of how that gene stuff works. It's quite interesting. Now, apparently it's more common in Tasmania. I'm not sure why that is. It'd be interesting to find out, but yeah, I mean, it is what it is, I guess. There is no cure. Treatment aims at slowing the progression of the condition, and all babies are screened at birth in Australia. 65 roses, the symbol of the rose comes from how a child sounds, saying cystic fibrosis. Okay, and that's obviously for the charity involved with cystic fibrosis there. Some statistics. 1 in 2,500 babies are born with cystic fibrosis in Australia. That's one baby born every 4 days with cystic fibrosis. Now, I was watching some stuff earlier today, and I think it might come up here. I think it is definitely a Caucasian disorder. So I think in African people it was 1 in 12,000 or something like that, 15,000, and in Asian people it was something like 1 in 30,000. So there's a huge difference there. 1 in 20 Tasmanians are carriers. So if you do the maths there, that well, I mean, I wouldn't be able to do the maths in my head, but if you do the maths there, 1 in 20 are carriers, and if 2 carriers have a child, that child has a 25% chance of having cystic fibrosis. If I'm doing my maths right, there are approximately 1 million carriers in Australia, which actually seems quite high. Okay, around 1 in 25 people, around about 1 in 25 people are cystic fibrosis carriers in Australia. It's about 25 million people in Australia. And of course, again, this shows you, again, we're talking about the genealogy of it here and how it's carried from mother and father down to child. And you can see down there that only about 1 in 4 or 25%. But interestingly, 50% of their offspring have cystic fibrosis. Now that are carriers, sorry, but that doesn't mean that if that couple have 4 children, that 2 will be carriers and 1 will have cystic fibrosis and 1 won't. So it doesn't quite work like that. Every time they have another child, there's another equal percentage chance that so 25% will, 50% will just be carriers and 1 won't. And then the next time they have a child, again, there'll be a 25% chance that 1 will, 50% that 1 will be a carrier. So it won't eliminate the one option after the first child has been born with or without, if that makes sense. Okay, so how is cystic fibrosis diagnosed? The Guthrie-Hill prick test on newborn babies, and the sweat test if the Guthrie test comes back positive. And that's because there's extra with obviously the chemicals we were talking about earlier, the chloride and the sodium. There's a lot of extra salt, so that the skin of people with cystic fibrosis will be a lot more saltier, which is not necessarily a problem as far as I'm aware. It's not really a medical, there's no medical issues with that or for any reason why people would necessarily, in general, I guess, would need some type of medical care for that. As far as I'm aware, I could be wrong. And health problems with cystic fibrosis. So realistically, there's a whole range of stuff that it can cause as far as health problems. Probably the main one is lungs, and of course the additional infections and things like that can come from that. The digestive system, specifically the pancreas, and malnourishment. If, for example, the pancreas helps people digest stuff, so digest food. So being able to obviously digest food and get the nutrients out of food is really important, as opposed to it just passing through your system. So as soon as you've got issues with all these different things, and it all comes from that mutation in that gene, which affects the chloride and the sodium. So it affects those two relatively simple, I guess, are they minerals? Possibly minerals. So it affects those 2 chemicals in the body. And that's what causes all these other issues. Symptoms, that probably should have popped up first, being the title. Poor weight gain, troublesome coughs, repeated chest infections, salty sweat, loss of appetite, and abnormal stools. Mucus buildup in the lungs. Again, that was probably one of the main ones we spoke about. Now here's a little, you guys can go and research these in your own time. Again, there's a lot of different disabilities that we do cover, and I would recommend learning the basics of 10 or 20 or so, but there are a lot out there. And realistically, as far as we're concerned with working with these children on a day-to-day basis, we don't want to go too far into the medical side of things, but we do want to know a few little basics and then take it from there, because you never know, you might end up working with someone that has cystic fibrosis for a few hours a week. So it's good to be able to know the basics, and then you can go off and do the research and learn a bit more. At least you've got somewhere to begin, and you can think, well, I remember studying this a couple of years ago, and take it from there. And again, with cystic fibrosis, probably the main thing where people typically have the most amount of problems, from what I can tell, is as far as the lungs are concerned, that constant cough, the mucus issue, the infections, the potential for having to have lung transplants at a later date and things like that. But as it says over there, obviously, lung transplants may be required, but otherwise sometimes, if it's too severe, it can cause death. And all these things up here are popping up in the wrong order. Repeated infections and blockages to the chest can lead to irreversible damage. Now that's what the word, if you look at cystic fibrosis, I mean, that's what what they're talking about with cysts. Those cysts, especially in the liver, for example, those causing scars and things like that, which is where I think the word fibrosis comes from, but someone can probably correct me on that. What effect does excessive mucus have on the pancreas? So the pancreas can become clogged with thick, sticky mucus. Mucus can affect the releasing of enzymes needed for food digestion, and this obviously affects nutrition because food isn't being digested properly. Severe impacts include malnutrition, poor growth, physical weakness, and delayed puberty. So quite often you'll see people with cystic fibrosis. They may be shorter and of smaller stature than people who don't have cystic fibrosis. Symptoms of salt depletion and dehydration. First is an obvious one: loss of appetite, tiredness, listlessness, cramps, headaches, sunken eyes, difficulty concentrating, grumpy or irritable. Now, obviously, I mean, they're the type of things that you may notice. It's unlike ADHD and autism, this is definitely one where the amount of work that you need to do from a strategy point of view is probably less, besides the obvious things, like they may need additional toilet breaks and things like that. But the amount of work that you'll be required to do from a strategy point of view would be considerably less, I would say, than from, say, autism, which is more about behaviour and interaction with others and social aspects and things like that. There is nothing in cystic fibrosis that has anything to do with learning disorders, behaviour, and those types of things. So from that point of view, from an educational strategy point of view, it's probably a lot easier and a lot more simple, because the medical side of it isn't what we would be looking after or what we would necessarily be concerned with, besides following the doctor's instructions or parents' instructions. What treatment is available? Daily airway clearance techniques to reduce mucus buildup in the lungs, tapping, and those vests as well. Enzyme replacement tablets to aid digestion. Now, they're generally taken sometime around eating, I would assume while eating or just before eating, and they would help the digestive system do its job, because otherwise you're eating, say, a carrot, and instead of getting all the nutrients out of that carrot, it's just going straight through the system because it's not able to be digested and all the nutrients aren't taken from it, and of course there's a discomfort and things like that. Yep, looks like we're missing one there. No, it's just going to pop up a little bit later. High energy diet, including fats and sugars with added vitamins and salt. Daily exercise to keep lungs strong and physical strength. Regular visits to the doctor or the cystic fibrosis clinic. Okay, and you see a picture down the bottom there of one of those vests. I'm not sure what the name of those things are. When lung infections occur, quite often breathing apparatus or apparati are used. What may an educator do to assist a student with cystic fibrosis? Monitor closely in hot weather. As salt loss can cause weaknesses due to dehydration, obviously. And especially you may notice in a classroom, sometimes if you're in a demountable, the classes might get hotter and hotter, and of course, not necessarily due to salt loss, but also just due to general dehydration or general, sitting in a classroom for 8 hours, people can get quite weak and quite distressed and quite tired, lowering immune system and things like that. Obviously helping students with medication, and again, I'm always very, very careful here. I really, really don't think you should be helping kids with medication unless you've got nursing qualifications. So a little disclaimer, we're not advocating here that you should be assisting students with medication, and if anything, if you see a student with medication at all, don't let them take it. Make sure you take them to a teacher or to a deputy or someone like that. Do not let kids take medication in front of you, because if they've taken the wrong amount, or they then turn around and pass out and have an allergic reaction, or they've already taken it in that day but forgotten, or something's gone wrong, and then they pass out or need an ambulance or something, then you could potentially get in trouble. So plus, I think you might feel a little bit guilty as well. So really, any types of medication, if it just accidentally falls on the ground out of a student's bag, get that student to take it to a teacher and let them deal with it. Just pass the buck with that. The only exception I would probably say is the asthma inhalers. But anytime you see pills, then pass that on and pass that information on straight away. I certainly wouldn't be taking the responsibility of being the one that has to remind a student to take a certain medication, unless, of course, maybe if you'd gone on and you were, you'd had quite a bit of experience and you had completed higher level qualifications, maybe some medication courses or something like that. But realistically, that should be the office or the deputy or someone like that, in my opinion. Although schools are different, it depends on the school. But I think as an education assistant, it's really not really your job in most cases, in my experience anyway. Might be slightly different in rural schools, but I mean, I've worked in rural schools, and I remember the kids at 12 o'clock would just go up to the front office. That wasn't for cystic fibrosis though, and they would take their pill up there. And I would just be err on the side of caution and try not to deal with anything to do with medication if you can. Assist with coughing and back physio technique. Make a toilet pass for frequent visits. Allows for easy access to drinks and monitor thirst. So the usual healthy health type things will quite often be written down in some form. There'll be some type of plan somewhere, or there'll be some instructions given to the school or something like that. So just make sure you're very aware of exactly what you're required to do, and just be very clear on what you're required to do. Again, be very clear on your responsibilities. Are you the one responsible for making sure they're hydrated? Are you the one that's responsible for making sure that they're taking their medication? Or Are you the one responsible for making sure they're eating properly and those types of things? Or are you just the EA sort of helping out? So just be very clear about what your job is with all these types of disabilities, because you don't want to be the one getting in trouble because a student has forgotten to take their medication or hasn't eaten and then passes out or something like that. Okay, so that's definitely a discussion worth having if you're given the responsibility of looking after a child for a day or longer. And then if it is your responsibility, make sure it's clearly written down, make sure you've got an alarm set, make sure that you've got backups. So the student has got to remind you, the teacher's got to remind you as well. Have some backup systems in place. But usually there's some type of action plan so that everyone is on the ball and knows what's going on. And normally that's set up. A parent will come in with information that the doctor's given them and stuff like that from so the cystic fibrosis clinic, as they were talking about earlier, or a pediatrician or whatnot. But again, just be very clear on what your roles and responsibility are, what you're expected to do and not expected to do. Don't be afraid to ask. Encourage daily exercise. And washing hands. So obviously washing hands and learning how to wash hands properly, learning how to spend 30 seconds to a minute or two washing hands. All our aged care and childcare students do this, but in education support it's kind of overlooked a lot. But in aged care and childcare, all our students spend a lot of time actually learning how to scrub their hands properly and learning how to dry their hands properly. As they say, washing your hands is a waste of time if you don't dry them properly. So I would be looking that up. It should be in your book, but make sure you're teaching kids how to wash their hands properly and make sure there's actual decent soap available for them as well. Assist with catch-up work or preparing work for a child in hospital, which is always an ethical and moral thing to do. And I suppose if you're working with those children regularly, then it's a good chance that you or the parent or the teacher would be in very regular contact with the child. So quite often, if you feel confident enough, I would be offering some additional support there, especially if, say, the teacher's going through their daily lesson and you're taking notes, or at least collecting things that is occurring during the day so that you can pass it on. And the same in childcare centres and things like that, so that they don't feel like they're missing out because they're sick in hospital, and they can come back and join in with their friends and those types of things. Okay, infections and germs with cystic fibrosis. So this is a very big issue with people with cystic fibrosis because obviously infections, especially on the lungs, is quite common. Regular hand washing, very important. Inform parents to keep sick children away from school. So that's not the kid's parents with cystic fibrosis, that's other children. And as well as EAs, because your colleagues quite often will feel responsible and feel that they need to go to work even though they're sick and coughing. You might need to tactfully ask them if they, stay home if they're sick, which might be difficult in some cases because some people are very committed to the job, but it also causes other problems. Help your cystic fibrosis classmates stay healthy and out of hospital. Simple colds can become very, very serious. Okay, now this is just some additional information. I'll just quickly read through it. Reduced life expectancy. With good management, people with cystic fibrosis are now living well beyond 35 years of age. Developing diabetes from damage to the pancreas is also an issue, and that's got to do, it's not necessarily developing diabetes as well, but also exhibiting signs of diabetes because of issues with blood sugar levels, and things like that, type 1 diabetes. Asthma, which can limit their ability to exercise in some cases. A person with CF cannot be in the same room as another person with CF. The bugs in their lungs from chest infections, which are generally harmless to non-CF people, are highly infectious to those with CF and can spread easily. These bugs, I won't even try to pronounce that. Yeah, I won't even try to pronounce that. You can look that up if you really want to have a shot at pronouncing those. Now, again, so there was nothing in this presentation about, from our point of view as educators, how we would manage these children, because very much the management is on a medical sort of point of view, not so much from an educational point of view. Realistically, infection control is very important, keeping things very tidy, using antibacterial wipes quite regularly, those types of things is really the only changes that are obvious and across the board. But again, you need to be allowing for additional toilet time, or the fact that they may be sick a bit more regularly, or need to moderate their exercise a bit more. They might not be as physically strong as other people in the same age bracket and those types of things. So obviously problems with eating, additional sickness and stuff like that. So, but realistically, if we're saying, well, there's no issues with people with cystic fibrosis interacting with other people because of cystic fibrosis at any rate, and there's no issues with them learning a new skill like a new maths or algebra or spelling words or things like that, which could be a bit more common in, say, ADHD, where you've got issues with paying attention and keeping on track and concentrating, or with autism, where you've more so got issues with social interaction and sensor being hypersensitive and things along those lines. So, and there are very common strategies that can be put in place with autism specifically, but with cystic fibrosis, it's not something that you'd be overly involved with. They would generally be conducting themselves in a classroom as all the other children would be. Okay, so I hope that made sense, and I hope I didn't make too many mistakes as far as the medical side of things go. If I did, then I apologise, but certainly I'd be encouraging you to do your research. If you're working with kids with cystic fibrosis. If you're not, then don't be too concerned. At this stage, we're only just covering the basics of it. If you can sort of talk about what it's about, and it's got something to do with infections and lungs and salt and these types of things, and it's not a neurological disorder. Yeah, it's more of a physical, genetic disorder. If you can sort of talk a lot and basically say those few things, then that's really all that we'd want out of you at this stage.